Netizens and medical practitioners have criticised several opposition MPs for pushing the Health Ministry to approve the use of Ivermectin to treat COVID-19 patients. Twitter user Dr Khairul Hafiz in a series of tweets expressed disappointment that many Pakatan Harapan leaders were pushing for the off-label use of the anti-parasitic drug for COVID-19. Earlier today, the use of Ivermectin to treat COVID-19 patients became a heated topic in the Dewan Rakyat, with several opposition MPs pushing for it to be used immediately. Health Minister Dr Adham Baba, however, stood firm on waiting for data first. The MPs, who were from PKR and Amanah, claimed that India and the Philippines had successfully used Ivermectin to treat COVID-19 without any reported side effects. However, they failed to mention that the health authorities in both countries have never announced this publicly. The MPs calling for the use of the drug were Amanah President Mohamad Sabu, Khalid Samad, Sivarasa Rasiah, Johari Abdul, Tze Tzin, Leong and P Prabakaran. Meanwhile, Azrul Kalab, Chief Executive Officer of the Galen Centre for Health and Social Policy, tweeted that it was disturbing to see many opposition MPs believing Ivermectin to be a miracle drug that will cure COVID-19. He urged Adham and the Health Ministry to stand firm on existing COVID-19 treatment policies and guidelines. Meanwhile, former consultant pharmacist at Belengme One said it was weird that many of these PHMPs were pushing for the off-label use of the medicine. Are they doctors? She asked. She then urged former Health Minister Julkifli Ahmed, who is also Pakatan Harapan's COVID-19 task force chairman, to stop such discussions by opposition MPs who are not medical professionals. Recently, the Association of Private Hospitals Malaysia said none of them are currently using Ivermectin. APHM President Dr Kuljit Singh said private hospitals have been treating COVID-19 patients since January by following the Health Ministry and International Medical Society's evidence-based guidelines. In June, the Health Ministry said hospitals are allowed to apply to the Drug Control Authority for the off-label use of the drug, including treating COVID-19 patients, but in a controlled environment. The Pakatan government, he claimed, has ignored its solemn parliamentary duty by advancing their personal gains at the expense of national interest.